Hey, it's Dr. C. Hope you're having a good summer. I'm having a decent one myself. Today we're going to talk about the healthcare system in the United States. I know, big topic. We got a brief amount of time, so I'm going to focus on certain aspects that you may or may not understand until I at least outline it for you. So, first of all, let's take the big picture, healthcare systems. Let's take the world. What's going on in the world? What kind of healthcare systems are out there? Well, number one, we have people with no insurance, uninsured. You can understand that. In the United States, roughly about 10% of people are still uninsured in the United States. What else? There's a national health insurance system. That's what they have in England. National health insurance. That went in the early 1960s. And of course, they've added to that now. They have some private insurance hospitals, etc. And we're beginning to infiltrate a little bit into that. But they have a national health insurance where there's a single payer. The government pays for the health insurance, or pays for the health of that country. That's number two. Number three, there's a beverage model. Not beverage you drink. Beverage model, that's the one that they have in Canada. The government still pays through taxes and all, they pay it. But it's up to the individual provinces, like, say, the individual states would pay individually. So it's the provinces that pay in Canada. Number three, there's a Bismarck type of thing as well. That's the one they have in Germany. And that's done through payroll taxes. So they have a little more difficulty with people who aren't working, obviously, because it's mostly funded by payroll taxes. And then there's the one in the United States. Now, the one in the United States is a hodgepodge. It's got every possible scenario you can think of in it, because we are capitalists. And what do capitalists do? We make money. And so, why healthcare? Why healthcare? Well, in 2022, our healthcare bill here in the United States was $4.37 trillion. Trillion dollars. Well, don't you think that all the capitalistic entrepreneurs in our country open their eyes up? They say, oh, we got to tap into that. And they have in a big way. And I'm going to explain that as we go along. So we have this big hodgepodge here in the United States. So, and we still have 10% uninsured. 10%. Okay. Where do we go from here? Well, you listen to the politicians if you want to listen to them. I don't even listen to them because they just banter on. All they care about is themselves anyway. But they always start out when they talk about health care. We have the greatest system in the world. What a load of crap. As soon as they say that, I turn it right off, because you know they don't know a damn thing about the health care system. We don't have the best system in the world. It's far from it, as a matter of fact. It is, however, much more expensive than any health care system in the world. Much more expensive. And so, maybe that's what they're referring to as we have the greatest in the world, baloney. And I can prove that we don't have. Just look at COVID lately. Which country had the worst death rates? United States is right up on top, the highest death rate. And you saw the fiasco from our federal government with COVID. So, number two, more immature deaths. Why? Because our legislators won't do a damn thing about gun control. And that may seem like a simple thing, but it isn't. And you understand that. We don't control guns. Guns are killing people. Many of them in the United States. We also have a higher suicide rate here in the United States. Third largest in the world, the United States. We also have a trouble with opioids. No country is as bad off on opioids as the United States. in terms of opioid deaths. So, again, our healthcare system. We have a high maternal mortality as well. We are 46th in the world in terms of maternal mortality. Infant mortality, we're up there, up high in terms of infant mortality. We're, in terms of obesity, roughly 71% of men are obese in the United States. 62% of women, obesity, simple like that. We are the leader in the disability category in the world. We have very poor access to health care compared to other countries as well. We have fewer physician visits as well. We have more hip replacements, more coronary bypass surgeries, more of these procedural things that pay better than any country in the world. Now, don't tell me that we have the best healthcare system in the world. We're paying roughly an average of over $13,000 per person in the United States. That is big bucks. And what are we getting for it? So, I can go on, but we don't have the time. Let's go on to this. We have, in our hodgepodge system, we have many different ways of parceling out that money. Number one, we do it through the insurers. Now, since it is a hodgepodge, we have over 7,000 insurers in the United States, but roughly about 900 insurance companies that actually have a significant number of people that they cover. So we do it through insurers. Some of the big ones are the big ones, really big ones, like United Health Group. Now that United Health Group, I'm going to go a little further in a minute about that group, but we'll talk about that in a moment. We also have Medicare. Medicare last year had a budget of $901 billion, paying out a lot of money. Medicaid going up excrementally every year. Last year was up to $734 billion. We also, for prescriptions, spent $378 billion a year. Physician and all of the associated physicians, and that also includes the health instruments, etc., all of the ancillary things, $860 billion. And in the hospitals, $1.3 trillion was paid out to hospitals. So that's our system, So what else? What else is important? Well, let's go on. Let's talk about those. I said we were going to talk about some of the major healthcare systems that are out there. What is a healthcare system? A healthcare system would have to have certain elements in it. Number one, they have to have, at least one acute care hospital that takes care of acute care patients. Number two, they need to have at least a group of physicians, primary care doctors, at least 10, and specialty doctors, at least 50 in that system. And then finally, it needs to be regional. In other words, all of the people in that region can go to that system. So those are the major parts of a healthcare system. Now, as I mentioned to you, the most common, or at least the most, the largest anyway, is the Hospital Corporation of America. Hospital Corporation of America. It's a huge, huge corporation. And they own 210 hospitals in the United States now. 210. They also own a number of other facilities like assisted living and nursing homes, etc. Now, I thought somewhere along the line that there were restrictions on who could own, say, a medical practice, or getting into buying the medical type stuff like that. A business entity in Massachusetts, for example, can't own a practice, a physician group practice. But the way they get around that is they will not own the practice themselves, but they will buy an interest in the practice, but not own the majority stock of that practice. And they will have somebody in their corner, a doctor, and that's the name that they will use. So that's one way around it. Another way around it, too, and this is what they all do, they'll buy into and run the practice. In other words, they do the recruiting, they do the billing, they do the go after the people who aren't paying. They run all of those ancillary things that have nothing to do with the actual clinical practice of medicine. So that's how they get into it. That's how they make their money. There are a number of them besides the Hospital Corporation of America. You may be more familiar with Tenet Healthcare. Now, they're not the largest, but I think they're third or fourth in the list of the larger ones. But they are all part of this health care system that's out there, and they're buying up a number of different hospitals and practices that way. Kaiser is another one. Universal is another. So there's a number of these healthcare entities that are out there. So, and roughly in the United States, there's over 1,000 of them. 1,000 of them. Can't even believe that. But that's how they work, and that's how they get into the system. Now, they also, remember I talked with the insurers, the United Group, United Health, the largest of the insurers. They're smart. They're smart in many ways. What they also did was they got into what was called the integrated health system. In other words, they'll have an interest in many different aspects of the health. They'll buy all these things up. They'll run them. They'll run them. A good example is Optum, Optum Health. Optum now, I think, is the largest employer of doctors in the country. Largest in the country. So, my God. At any rate, I don't want to go on with some of these things, but they drive you crazy if you look into some of these. What else? What else now? Well, let's go on. It isn't just the healthcare systems like I mentioned, like the Hospital Corporation of America, but now we have the private equity companies. $4.37 trillion, a lot of bucks to be made. So a lot of the big brokerage houses now will get smaller investors to invest in these corporate entities now, and they're all on the stock market now, invest in that, and they are called private equity groups. They pay a dividend to the investors. Now, the private equity groups, of course, will offer a hospital or a practice or whatever, offer them money. Offer them money. We'll bail you out. We'll give you some money. But they don't only get the money from the investors. They also borrow money because they have a big balance sheet. They're billion-dollar corporations now. And so they borrow money. Now, they are always making money. They will own a practice or a hospital for about 5 to 10 years. That's the max. That's the max. And they usually sell it then to a larger entity. Once they have milked it for all the money they can get out of it, they will then sell it to a larger entity so they can milk a little bit more. Money, 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 money. So private equity firms are very, very common out there. The largest one is called Blackstone. Blackstone, far and away the largest of all of the private equity firms. And they even buy, besides hospitals, nursing homes, and assisted living, they also buy when you die and all, they will buy all of the things that you normally would require. So if you wanted to go on to hospice care, for example, I would absolutely ask the question, who owns your hospice? Who owns it? Are you out to make money, in other words? They get $150 a day for that hospice patient. Now, that $150, they're supposed to be seen every day. That doesn't happen. It doesn't happen. But they still get the $150 a day. So they make money. Money, money, money. Okay. What else? What else? Well, let's go on. Let's say that you're sick. Where can you go to get help? Now we're getting down to the more nitty-gritty now. Where do you go for help? You can go to an emergency room. You can wait 12 hours. First of all, be seen by maybe a medical student, then by a senior medical student, then by a resident, and maybe an attending at the end. So you're probably going to see about 4 or 5 different people before they will go ahead and try to make a diagnosis and treat. That takes hours on end, okay? So that's the emergency rooms. Now, how many emergency rooms are there? Well, there's roughly about 1,360 emergency rooms in the country. They all have the same problems. But that's one place you can go. Number 2, you could go to an urgent care. Now, in urgent care, there are about 9,000 urgent cares in the United States, roughly 9,000 now. They are being rapidly put up and owned by these private equity systems. So roughly 40% now are owned by corporate entities, 40% of them. 16% of those urgent cares are owned by hospitals. And about 15%, there's a joint venture between hospital and the private entity. Okay, so those are the ones who own it. Now, usually an urgent care is specifically run by nurse practitioners, maybe some physician assistants, but mostly nurse practitioners. They, by and large, see you much quicker, and if you have a decent nurse practitioner, they take good care of you. So, urgent care, that's the second place that you might want to go. Where else might you want to go? Well, you could go to CVS. They have what's called a minute health care. Roughly 1,100 minute care facilities are out there now in the United States. 1,100. Again, they're run by nurse practitioners who are employed basically by CVS for the Minute Health. Walgreens has their own. They have Medical Express, but only 290 of those in the country right now. Walmart has their own. And I don't know what Walmart calls them, but at any rate, Walmart has them, but they're a much lower number than CVS, which is a much larger of all of those clinics. So those are all of the things that you could do. You could also call your PCP. Good luck trying to get in, see them for any urgent thing. The other thing, too, is the education part, the educational part. So let's talk a little bit about that. First of all, let's talk about the doctor's education, okay? You can start out, you got 4 years of medical school, 4 years. So you would be, if you went to, say, UMass, you would be UMass 1, 2, 3, 4, okay? You may be rotating all the way around. So the next time you go in, you're not going to see that same medical student, obviously. From there, you go on to a residency. Now, the residency, depending on what specialty you're going in, if you're going into family practice or if you're going into internal medicine, those are the two that make up that primary care. Or you may go into pediatrics, geriatrics, whatever. But It's a 1 to 3 year residency program. Then you may want to specialize a little, so you become a fellow. May become a fellow. Usually a fellowship is 1 to 2 years. And now you're specializing in a particular aspect of that practice. Then you become an attending. Now, if you happen to be in a university setting, you may start out as an assistant professor. Wonderful. Doesn't mean anything, just assistant professor. You then, if you advance in that, you may become an instructor. Whoa. Then, a few more years later, an associate professor. And then, as time goes on, you may become a full professor. And then when you're ready to retire, you're an emeritus professor. Wonderful. Also, these are all clinical names. They're also, in the associated field, research positions. So you may be an assistant professor, research professor. You may be a research instructor, all the way up to professorship again. Now, there are a lot of different people who work at the hospital, and the doctors are called hospitalists. They get their paycheck from the hospital. They only treat patients at the hospital. In other words, the primary care doctor out in the community, they can come in and see the patient, but they're not actually treating the patient. The hospitalist is. So, okay, that's the way it is. Now, besides the physicians now, got the nurses. Now, what type of stuff can you get from the nurses? The ones who do a lot of the work, the grunts, the ones who are at that bottom rung, who are doing most of the work, are the certified nursing assistants, CNAs. Now, these CNAs roughly have about 6 to 8 weeks of training, 6 to 8 weeks. And they get a certificate. They can become a CNA, and they can get a job. Then there's the licensed practical nurse, LPN they're called. They can get a 12-month period and get a license as an LPN. There are some things they can't do. You have to be a full RN in order to do a lot of the things that the nurses do. But the LPNs and the certified nursing assistants do most of the work. They're the actual people who get their hands dirty with the patients. So what about the nurses now? Well, you can get a 2-year degree, get a certificate. You'll be a nurse, but you only get your certificate. You're not a true bachelor's RN yet. So bachelor's is 4 years, 4-year degree. Then most of them then, after a year or so, they get a few bucks in the bank and get their master's. That's another year. Get their master's. If they have and they can afford it, they don't have a big family to do other things, 3-4 years later, they can get a PhD. Get a PhD. Nurse practitioners like to work their way up as well. The nurse practitioners, they put in their time as well, and it's the same schedule. You become a NP, nurse practitioner, get your master's in another year. 2-3 years later, you can get your PhD. They don't get their hands dirty. They're the ones that are calling the shots at the top of the thing. You can get a case manager. All you got to be is an RN, be a case manager. So you see that under the little name tag, case manager. They're usually RNs, or they may even be a nurse practitioner, but usually they're RNs. And their job, basically, they're being paid by the hospital, and their job is to get you out of the hospital to an appropriate facility. Okay. You could be talking to a secretary. Usually you make a phone call, you're talking to a secretary. So if they've been with that doctor for a period of time, they can give you advice, but is it worth anything? Well, I don't know. Now we're into the telemedicine. Telemedicine as well. You have no idea with the telemedicine what the credentials are of that person you're talking to. No idea. And then you have people who are just observers. These are usually the foreign medical grads who need to get some experience, so they're just observing. But they do help out a little bit. So that's the structure that is out there that you see. Okay? So what else? What else? Well, knowing that, I think that right now, if I got sick, I would probably, depending on how serious I think it is, I would probably still want to go to an emergency room because I may have to be hospitalized. So, but if it's an average thing, like say you're worried that they may have a pneumonia, or they're having an asthmatic attack, or they're having something that's not going to kill them necessarily, urgent care. Urgent care is a good thing. So I would probably opt to do that. The people who work in all of these other facilities, like a Walmart or Amazon, I guess Amazon is getting into it now, CVS, you're depending on that person in the local area. And remember, there's a lot of those facilities now that are out there. And so the experience of the person behind that counter varies tremendously. It varies tremendously. So you may or may not get the treatment that you deserve, basically. Our educational process has not improved. Our educational process, when I was going through it, was like an apprenticeship. You worked, you were there, you saw all of the people coming in and out. You were on site. Now, it's all virtual. They may never have seen a person who has a particular illness, and yet they may be called upon to make a diagnosis, and they're alone, So healthcare education is sorely, sorely lacking here in the United States. Well, in a nutshell, that's it. I hope I didn't bore you with all of this. I can go into any aspect of it you want, but that is it for today. This is Dr. C. Have a healthy day.